Now let's talk about hairline shapes. Hairlines can be rounded, U-shaped or V-shaped. The choice depends on the patient's features and preferences. The age appropriative hairline. So what is age appropriative hairline? Though it is important to consider the patient's facial feature and the facial shape, it's crucial to create an age-appropriate hairline. So suppose if I have a patient who is in men in their 20s or 30s, a slightly receding hairline with a natural peak in the front. Then if the patient is in their 40s or 50s, a more mature hairline with a more gradual recession. Men in their 60s and older, a more conservative hairline with a softer peak. So that's the hairline design. Now coming to the natural density and irregularities, patients should note that the natural hairline usually isn't perfectly straight. It has an irregularity and variation in hair density. So many a times if the patient says that, okay doctor, I want this kind of hairline, straight hairline, I give them a suggestion that okay, don't go for the straight hairline, it may look artificial. At DNCC, achieving the perfect hairline design is a blend of science, art, experience and the patient's preference. So considering a hair transplant, reach out to our expert at DNCC. We will provide you with a hairline and hair design and hair transplant which is almost natural, and will do it according to the facial features and the shape and the old pictures to give you a more youthful and confident appearance. Thank you so much.